XOE has really been developed over 20 years with an investment of about $10 million to get extracellular nanoparticle technology. And this is something that is the new. If you go to a trade show, we were just recently at the aesthetic show, and there was presentation after presentation on exosomes. So, there's getting to be a lot of passion with it. People are excited about it. And I think it's the new direction that everyone's going. And so who can find the best way of doing it? What we have in the XOE product is Dr. Newman. He led the entire research on this. He's the leader of it. He's out of Beverly Hills, California. He is a board certified dermatologist, fellowship trained cosmetic surgeon. And when you read through all the things that he's been involved in, when it comes to this, it's impressive. He has spent 20 years of his life. That's how passionate he is. And so he has a lot of patents. He has written articles. He lectures all over the world on this sort of thing. And so his specialty is stem cell therapy, and he's very good at it. He has a whole team of people, and he has created a product that we've been fortunate enough to get to use for some time now. And we've done some studies with it, and we love the whole comprehensive approach that we're going to get to talk about tonight. So when you look at the development of XOE, again, it was his passion for discovering a safe, holistic. He wanted this to be natural. He wanted it to be holistic, and he wanted a new approach to controlling cell signaling to stimulate rejuvenation. And when you think about that, that can be used in a lot of different ways. But to just take that and to say, okay, what did that develop? What did that get us? Well, of course, we have a complete organic stem cell system. It came from stem cells. It contains everything that you need. We have secretory factors. We have growth factors. We including everything that's coming from the stem cell. We have small molecules. And this little is probably the wrong word for this, but his approach to putting this together has been so powerful that you'll see in the before and afters, and you'll see what it does, but how it affects the treatment, before the treatment itself, and then post-treatment. And I think that's really the key to it. The product, it does not need to be frozen. It does not need to be refrigerated. It's used with light-based without any problem at all, and we use it with resurfacing, and we do a lot of it. And it's readily absorbed into the dermis. And so the thing is, you're not injecting, you're not doing anything like that. You're simply applying it to the tissue and giving it about 10 to 15 minutes to completely absorb. And so this is part of the whole system, and it's very important. So what he found in his research and his study is that the stem cells produce factors similar to human factors. So everything is very, very similar. And so you have the human cytokine effect. And what it's doing is allowing for the same kind of results that you got with human exosomes. So doing plant versus human results were almost identical. Plant-based is huge. And when you look over what's on the screen right here, organic, gluten-free, it's water-based, vegan, paraben-free, sulfate-free, all of this. It's not tested on animals, water-based. But the key thing here, produced in FDA registered and GMP certified facility in the United States. And so you have a product that is extremely safe, extremely natural, extremely clean and pure. that you're using all the time, and we love it. We love the process with it, and we love what it's doing for our patients and what it's doing for our practice. What do we have here? It's a game changer, and I think people use that terminology loosely nowadays. Oh, this is a game changer, that's a game changer. But if you take a patient and you're looking at wanting to really help them, you want to improve their overall appearance, what are you going to do? You know, we do know that a lot of times some of the more aggressive things we do get a bigger reaction or maybe a bigger outcome, or you can take a process of doing something more frequently and not quite as aggressive. But in any case, are there any patients out there that love pain or swelling or downtime? You know, none of that. They want the wound healed. They want to get back to their life. And so if it's taking you longer, if the process is slower, if there's a longer recovery time, if there's more pain, if there's more redness and swelling, whatever, downtime, that hurts your ability to do what you do. And that affects your bottom line. And so when you're looking at the dollars and cents of something, if this were the only, and it's not, we're going to come back to this, but if this were the only thing that it helped correct all by itself, that's huge. To eliminate what you're seeing here on the screen, to make it more acceptable, to take days off of a healing time and a process that people go through. So it just changes everything. So you are shifting the healing cascade away from inflammation directly to rejuvenation. And that can't be overemphasized. And I think that those of you out there doing resurfacing or doing different procedures where it tends to be a little bit longer downtime, but this is a game changer. And that's why I say game changer is true when it changes things for your patient to such a degree that they go out and tell other patients about the success they're having with your procedure. And I think this allows that to happen. So it's very beneficial. So when you're looking at human dermal microvascular endothelial cells, okay, so they take these and you're looking at the scenario where there's no inflammation. You see a little bit of redness in the cell, in the nucleus. You see some of that, but not very much. Now look at the induced inflammation. It is red everywhere. And so you start looking at that. That's the inflammation. And what have we done for years? We do a treatment, and what do I tell the patient even prior to the treatment? Now, with the treatment, you're going to get red, you are going to swell, and hopefully you actually look worse. And, you know, no one wants to hear that, but I tell them that up front because that means that I did a good treatment, right? So that's what I have been selling for a long time. Instead of calling me at 10 or 11 o'clock at night that you're red, you're swollen, you're uncomfortable. If you're red, swollen, uncomfortable, throw a party for yourself, right? So, you know, because that means you got a good treatment. Well, that's old. That's old. We don't have to have that anymore. If you look at the anti-inflammatory effects, there is still a little bit of inflammation, but nothing like what you see on the second little slide there, the induced inflammation, nothing like that at all. And so it's all the difference in the world when you can get rid of the inflammation. So if you take this patient that we treated here, and this is fractional resurfacing, about 150 microns deep at 22%. And you'll see her picture again later. We're going to come back to it. But if you look at the side treated, which is her left side, versus the side not treated, the right side. Okay, so is there still a little inflammation on the left side? Yes, but very minimal. Now, this is a patient that can take a shower get cleaned up. And if her entire face appeared as the left side, she would be able to go out and have almost no one notice. And that is less than 24 hours after a resurfacing treatment for acne scars. So again, that's a huge change from the right side, where she could have that swelling for another 2-3 days, and not be able to go out. And in some cases, it lasts longer for some patients. And so if you can, again, going back one slide and going back and get it to the anti-inflammatory, where you have anywhere from maybe 80-90% reduction, which is about what we're seeing here. You put her back in the ballgame right away. It changes everything. Is that patient going to be willing to do that procedure again? Yes. In essence, she had little to no downtime at all. She could go out, be okay with it. Worst case scenario, she gives it another day and starts the healing process using our post-treatment protocol, which we will get to. So this is a game changer for that patient, which makes it a game changer for us. So anytime you can do that and you can help a patient and you can get them back in their lifestyle quickly, and while at the same time, having done a treatment that is going to change them for the better for the rest of their life. We have the stimulatory effects, and XOE increases collagen and elastin expression, secretion of hyaluronic acid, all the things that we're looking for. So what you now need to think about is you just did some treatment on a patient, whatever it was. It could have been scarlet, it could have been laser, it could have been whatever it is. And with that, you're going to get more collagen, you're going to get more elastin. Well, at the end of that treatment, you took 60 seconds of your time to apply the XOE product. And by doing that, you've made the patient's life much better because of everything we just talked about. But what else? You just increased the expression of collagen by 28%. You just increased the expression of elastin production by 33%. And you've added 10% increase in hyaluronic acid secretion. So, this is like having done a whole nother treatment, right? So you did your original treatment that's going to get the patient this. Now, in 60 seconds, you just did a second treatment that's going to get them what you're seeing on the screen right there. Why wouldn't you do that? That has helped us in such a big way. And you're going to see that improves as we go into post-treatment protocol. But this is all good stuff. Why not? It is beneficial in multiple ways for the patient. So now, what do we need? We need the vascular endothelial growth factor. We know how important that is. It helps clean things up. You get cell proliferation, you get cell survival factor, you get all of that as part of it. And we've known that. That's all good, and that gets stimulated. So you get more of that. You actually, the cytokinins stimulate the transcription of VEGF. It does it. It increases it. And what does that really do? Look at the bottom. New blood vessels, response to oxidative stress. You get an increase in vascular permeability. Anytime you get angiogenesis, you get improvement. And you see that everywhere. Where those of you who've done treatments, vaginal treatments, you've done treatments for erectile dysfunction, you've done anything where you have increased the blood flow, what do you find? What's the patient come back and tell you? Things get better. It always gets better. And that's what this is doing. So you're automatically getting that as part of it. So that's very helpful. So what you're seeing here in the top screen is your control, and then you see the VEGF. Down below in the C screen is XOE, and this is 3 days. This is all a 3-day program on dermal endovascular endothelial cells. So this is what you're looking at. So when you see all of that going on in the XOE, that is dramatic. And Dr. King can probably discuss this further with you as far as exosome competitor. But I think what we're seeing is if you can get more blood flow, things get better, it heals faster. And, the discussion the fabulous discussion we just had on hair. Well, part of it is increasing blood flow, and that's why people will use red light caps and LED and things like that. Why? Increases blood flow. So we know how beneficial it is. You're automatically getting that. So again, big help. So here's our patient, and she started out with acne scars. This was her 3rd treatment, and it's a dramatic improvement from where she came from. But again, right side inflammation, left side, almost none. And this is the next morning. So treatment was done in the afternoon. She goes home, we put the XOE on, she goes home, gets up the next morning, takes a photo. Boom, this is it. And so this is what she looked like. And different people are going to have, some people tend to swell a little more, have a little bit bigger inflammatory response, whatever. But this has obviously blocked 80, 90% of it, probably about 90% for her. Now this next slide, this is Dr. Ann Watwood. I don't know if you can see the whole photo of her treatment side, but so on the right side, there is the swelling. And this is from Moxie. So this is a different treatment, not as aggressive. It's a level 2 Moxie. And yet this is the kind of swelling she had. So would she feel comfortable with the right side going out and to a party or going out socializing? Maybe not. But the left side, which I don't know if you have a clear view, dramatically better.
We can see it well, Larry.
Okay. Yeah, dramatically improved. So it really makes quite a difference. And then, of course, you start the post-treatment protocol. So that's what we're excited about, because you can take treatments that are not as aggressive as resurfacing. Now, we're known to do a lot of deep resurfacing here. And where we just tell them that, yes, you're going to look horrible, kind of a bloody stump for about 7 to 10 days, that type of thing. And we don't have our photos on that yet, but we will have photos for you. And a dramatic change in how fast people heal. Now, our patients all get LED red light therapy every other day with deep resurfacing. Why? Increased blood flow. So again, all we're doing all the time is what can we do to enhance not only the treatment and the results, but reduce your downtime, reduce what you're going through, so you're back in your normal social program as fast as possible. So when you do that, people appreciate it. Look at the 5-day at-home pre-treatment purification and the whole program. What is that? They call it detox, a detox serum twice a day. And all that you're doing is getting rid of the garbage, right? That's what it's doing. It's helping clean it up. It's detoxifying everything. And so many people are already doing things to the skin prior to bigger procedures. They prep the skin, and that's what we're doing with this. But it does it for you. Everything is being done for you without doing another treatment. This product is simply put on morning and night for 5 days prior to the treatment. So what happens with it? Well, you get 10 times the stimulation of HA. As you all know, At age 30, the production of hyaluronic acid is drastically reduced. And for many people, it's almost non-existent. So our peak is really age 15. At age 16, things start to slow down and we get less and less. And by age 30, for many people, it's over. You know, there's about 14 different things, including fibroblasts and collagen and elastin and HA and NMF and all these things that isn't at the level it used to be. And in many cases, it's almost stopped completely. And so as we age, we start to see it. We get a little older, we're starting to see what's happened. We don't have that anymore. We don't have that benefit. So hydration of skin prior to receiving aesthetic treatments have been very, very good. And you're just simply prepping the skin to yield better results. All right. So when you look at in-office paired with any procedure, what are you getting? You can do RF microneedling, laser, IPL, peels, threads, neurotoxins, all of these things. And, you know, most aesthetic facilities do a lot of this. And so it's working in synergy with what you're doing. It's going to enhance the overall experience for the patient. And you simply apply. You're going to do the before program, then you simply apply it. And in some cases, we actually apply it before the treatment, like with deep resurfacing. We'll actually apply it first, leave it on, let it completely absorb for 10 to 15 minutes, put numbing cream on, and before we do nerve blocks and all that sort of thing. So we will do it that way. But the key is you get blockage of 90% of the inflammatory response. I mean, you are still getting the benefit because of the cytokinins and everything else. You're still getting all of that benefit, but you don't get that overall look. So you have, thousands of factors that are helping you and helping the patient all the time. And of course, you're getting the stimulation, the simultaneous stimulation of collagen, elastin, and HA as you get the treatment. So your treatment is going to do some of that and hopefully a lot of that, and you are now adding to it. And you can receive up to 3 times faster recovery. So, even if it's twice, that's huge for patients, but in many cases, 3 times. And a lot of our treatments like profractional, we would tell patients, yes, just plan on roughly 5 days. But we don't do that anymore. 1 to 2, 1 to 2, that's it. Big difference. So again, I think it's such benefit for the patient, but again, we're also doing a whole nother treatment to help them. The repair is the post. Again, morning and night for 5 days, continued, blockade of inflammatory mediators, it just helps with comfort, healing, and everything else. 10 times the stimulation, increased circulation of soft tissue,